Welcome to our deep dive into upper limb anatomy. You've sent in some textbook excerpts and diagrams, even some clinical notes. Wow. So it seems like you're looking for a pretty in-depth understanding of uh, this complex part of the body.
It's really remarkable how much complexity is packed into something we use so effortlessly every single day.
Right. And from the looks of it, you want to cover everything from bones to potential injuries.
Absolutely. In this deep dive, we're going to be exploring the interplay of structure and function. And what better place to start than the foundation, the bones?
Yeah. I'm always so fascinated by how our skeletons give us both support and, movement. And your sources highlight how the upper limb is divided into sections, each with its own specific bones that contribute to the overall function.
Right. We can kind of think about it like a chain, starting with the pectoral girdle, which connects the upper limb to the torso. It's comprised of the clavicle and the scapula.
The pectoral girdle. So that's what gives us that incredible range of motion we need for everything, like scratching our nose or throwing a ball.
Exactly. That range of motion really sets it apart from the pelvic girdle, which is more built for stability over flexibility. But moving down the chain to the arm itself, we find the humerus. That's the heavy hitter of the upper limb.
The humerus. I've always been curious about why it's so prone to fractures, especially at the surgical neck.
Well, you have to think about the forces that go through the humerus when you fall on an outstretched hand. And that impact is transmitted right up the arm. And that surgical neck, which is a slightly narrower point below the tubercles, often bears the brunt of it. And unfortunately, age-related bone loss makes this even more common in older adults.
Right. That makes sense. And speaking of connections, the humerus connects with the bones of the forearm at the elbow. So tell me about the radius and ulna.
Well, the fascinating thing about the radius and ulna is how their shape and connection allow for those unique forearm movements, pronation and supination.
Hmm.
Imagine turning a key in a lock. That's the radius rotating around the ulna, and it's thanks to their unique articulation at both ends and that flexible interosseous membrane connecting them.
Wow. It's incredible how these subtle design features make such a big difference in how we use our hands. But there's more to the hand than just the radius and ulna, right? What about the wrist and all those intricate hand bones?
Oh, the wrist. The wrist is a marvel of flexibility, thanks to a cluster of 8 small bones called carpals. They're arranged in 2 rows and allow for a wide range of motion. And then we have the metacarpals, which form the framework of your palm, and the phalanges, the bones of your fingers.
All those tiny bones working together to give us dexterity. I'm starting to see why you called the upper limb a symphony of interconnected structures. But before we move on to joints, let's zoom in on a few of those intriguing details about individual bones that jumped out from your sources. The clavicle, for instance, has always fascinated me. It's horizontal, unlike most long bones, and it doesn't even have a medullary cavity.
The clavicle's definitely unique. It's the only bony connection between the upper limb and the axial skeleton, which explains why it's so susceptible to fractures. And, uh, and its position is key for allowing the incredible mobility of the shoulder joint.
Right, but speaking of the shoulder, I remember reading about the scapula and how it plays a vital role in shoulder movement too. It has that unique triangular shape with all those fossae and processes.
The scapula is kind of like the unsung hero of the shoulder. Those fossae and processes that you mentioned are attachment points for muscles that give us that huge range of motion. And remember that winged scapula condition we discussed earlier. That's when the medial border of the scapula sticks out, often because of an injury to the long thoracic nerve, which controls a muscle that keeps the scapula snug against the rib cage.
I never realized how vulnerable that nerve is. It really highlights how important each structure is for proper function.
Okay, so let's move down to the humerus again. Your sources list all these features: the head, anatomical neck, surgical neck, greater and lesser tubercles, and that's just the proximal end.
It might seem overwhelming, but each of those features serves a purpose. Like, take the greater and lesser tubercles, for example. They act as levers for the rotator cuff muscles, giving you the strength and control to throw a baseball or reach for a high shelf. So it's not just about the bones themselves, but how they interact with muscles and tendons, right? It's where those intricate details really come into play. Now, you mentioned the radius rotating around the ulna for pronation and supination, but how do they stay connected during those movements?
Well, besides their articulations at both ends, they're bound by a strong, flexible band of tissue. It's called the interosseous membrane. That provides stability, and it prevents the bones from separating during rotation. Unfortunately, because they're so tightly connected, a fracture in one often leads to a dislocation of the nearest joint.
Like the collis fracture I read about in the clinical note.
Exactly. That's a fracture of the distal radius,
Mm-hmm.
commonly caused by falling on an outstretched hand. And it's quite common in older adults, especially women with osteoporosis.
It's amazing how a simple fall can have such a big impact on our bones. And speaking of impacts, your sources mentioned that the scaphoid bone in the wrist, it's the most frequently fractured carpal bone. Why is that?
Well, think about falling onto an outstretched hand again. The force travels through the hand, and often the scaphoid bone takes the brunt of it. And what's tricky about scaphoid fractures is that they can be slow to heal because of limited blood supply to that area.
Yeah, it's like a chain reaction with the force traveling through the wrist and concentrating on that tiny bone. Okay. We've explored the bones from the shoulder to the fingertips. But bones alone don't create movement. So what about the joints? What about the joints that allow for all those amazing feats of flexibility and strength?
You're right, joints are kind of the unsung heroes of mobility. Let's dive into those next and explore how they allow the upper limb to move with such grace and power.
Okay, I'm ready to learn more about these unsung heroes. What are some of the key joints we should be focusing on?
Well, let's start with the star of the show, the shoulder joint, also known as the glenohumeral joint. It's a ball and socket joint that sacrifices stability for a wide range of motion.
Ah, the shoulder. I've heard it's the most commonly dislocated major joint in the body. Why is that?
Well, think about the structure. The head of the humerus is much larger than the shallow glenoid cavity of the scapula, where it sits. So it really relies heavily on muscles, like the rotator cuff, and ligaments for stability. And any weakness or injury to those support structures can make dislocation more likely.
So it's like a trade-off, incredible mobility, but at the cost of stability. I'm starting to see why shoulder injuries are so common, especially in athletes. But your sources mention more than just dislocations. There's also something called a labral tear.
Right. The labrum is a ring of cartilage that deepens the glenoid cavity, which makes the shoulder joint more stable. But forceful movements or repetitive strain can tear that cartilage, causing pain and instability.
It's amazing how even a small structure like the labrum can play such a big role in shoulder function. But before we get too deep into shoulder problems, what about the other joints in the upper limb?
Well, moving down the arm, we come to the elbow, and that actually involves three separate articulations: the humeral, humeradial, and proximal radial ulnar joints. These allow for those essential movements of flexion, extension, pronation, and supination.
I'm kind of curious about those specific movements. Could you explain them in more detail, maybe with an example?
Sure. Think about bringing your hand to your mouth to take a sip from a glass. That's flexion of the elbow. Now, extend your arm to reach for that glass. That's extension. To demonstrate pronation and supination, imagine you're turning a doorknob. That twisting motion is the radius rotating around the ulna.
Wow, that's really helpful. I never realized how much I use those movements throughout the day. But since we're talking about everyday activities, the wrist and hand joints must be pretty important too. What
Yeah.
can you tell me about them?
Well, the wrist joint involves the articulation between the radius and the proximal row of carpal bones, allowing for a remarkable range of motion. And then within the hand itself, there are numerous joints called the interphalangeal joints. Those enable all the fine movements of our fingers, from typing on a keyboard to playing a musical instrument.
It's incredible how all these joints, big and small, work together to give us such incredible dexterity, but I can also see how they could be vulnerable to injury, especially with, repetitive use or overuse.
You're exactly right. And those injuries can range from, simple sprains and strains to more complex problems like carpal tunnel syndrome, which we'll discuss in more detail later. But before we move on to the intricacies of nerves and muscles, is there anything else about the joints of the upper limb that you'd like to explore?
I'm curious about those clinical notes you mentioned earlier. They highlighted some specific joint problems that sound intriguing, like tennis elbow and golfer's elbow. What causes those?
Those are great examples of how repetitive strain can lead to joint problems. Tennis elbow, also known as lateral epicondylitis, often stems from overuse of the muscles and tendons that extend the wrist. Think about that repetitive backhand motion in tennis. That can put a lot of stress on those lateral epicondyle attachments. Golfer's elbow or medial epicondylitis is similar, but it affects the medial epicondyle and is often triggered by repetitive flexion motions like those used in gripping and swinging a golf club.
So it's not just athletes who are at risk then. Anyone who performs repetitive motions with their hands and wrists could be susceptible to these types of overuse injuries.
Absolutely. These conditions are commonly seen in people with occupations that involve repetitive hand movements, like carpenters, musicians, even those who spend long hours typing on a computer.
That makes a lot of sense. It's a good reminder to pay attention to ergonomics and take breaks to prevent these kinds of problems. But I'm also curious about a condition you mentioned earlier, radial head subluxation or nursemaid's elbow. It seems to be specific to young children. What can you tell me about it?
It is specific to young children. And thankfully, it's usually a simple fix. It happens when the radial head, which is part of the radius bone, slips out of the annular ligament at the elbow. It often happens when adults pull or swing young children by their arms, but a gentle maneuver by a healthcare professional usually pops it right back into place.
Okay, that's good to know. Sounds like something parents and caregivers should be aware of. But we've spent a lot of time talking about bones and joints. What about the muscles that power all these amazing movements? And the nerves that control them? Those are essential for the upper limb to function properly, right?
You're absolutely right. We've laid the groundwork by exploring the skeletal framework and the joints. But now it's time to delve into the world of muscles and nerves. Get ready. It's about to get electrifying.
I'm excited to dive deeper. From what I've seen in these sources, the interplay between muscles and nerves seems incredibly intricate.
It is. And the clinical implications of nerve damage can be, well, quite dramatic, highlighting just how vital these nerves are for everyday function. Let's explore those next.
Okay, let's delve into those electrifying nerves. It's amazing how these delicate strands control so much of what our upper limbs can do.
Yeah, it's a testament to their complexity and the very precise way they interact with muscles. And as your clinical notes highlight, when these nerves are injured, the consequences can be pretty significant.
Yeah, the sources mentioned that nerve damage can lead to a variety of symptoms depending on which nerve is affected and where the injury occurs. That seems pretty crucial for diagnosis.
Absolutely. For instance, we talked about winged scapula, which can occur when the long thoracic nerve is injured. This nerve supplies the serratus anterior muscle, which keeps the scapula nice and flat against the rib cage. Damage to this nerve weakens the muscle, causing the scapula to protrude, and that's what gives it that winged appearance.
It's fascinating how a single nerve can have such a dramatic impact on the appearance and function of the shoulder. And I noticed that your sources also highlight the suprascapular nerve and its role in shoulder movement.
Right, the suprascapular nerve is responsible for innervating two key muscles involved in shoulder abduction and rotation, the supraspinatus and infraspinatus. Entrapment or injury to this nerve can lead to weakness and pain, especially in the posterior and lateral shoulder.
That makes sense, given the location of those muscles. But those aren't the only nerves involved in shoulder function. What about the brachial plexus, that network of nerves we talked about earlier?
The brachial plexus is essential for the entire upper limb. And Herb Duchenne paralysis, also known as Erb's palsy, is a striking example of what can happen when it's injured. This condition typically involves the C5 and C6 nerve roots, and it's often damaged during a difficult childbirth.
Right. I remember reading about Erb's palsy and that characteristic waiter's tip position of the arm. It's incredible how a nerve injury can result in such a specific, noticeable posture.
It really illustrates how those nerves control muscle function. In Erb's palsy, the arm hangs limply at the side, internally rotated with the elbow extended and the forearm pronated. It's a visual reminder of the intricate interplay between those nerves and muscles.
Moving down the arm, we encounter the axillary nerve, which supplies the deltoid muscle. That's the muscle we use for lifting our arms out to the side, right?
Precisely. And damage to the axillary nerve, which often happens from a fracture of the surgical neck of the humerus or a shoulder dislocation, can lead to difficulty with abduction, raising the arm away from the body. There can also be sensory loss in a small area over the outer shoulder. Sometimes it's referred to as the regimental badge area.
That's a vivid way to remember the location. But let's move down to the forearm, where three major nerves take center stage: the radial, ulnar, and median nerves. Your sources seem to emphasize the radial nerve as the most commonly injured nerve in the arm. Why is that?
Well, the radial nerve has a long and winding course. It travels around the humerus in the radial groove, and that makes it susceptible to injury from fractures, prolonged pressure, or even improper intramuscular injections.
And I remember reading about the classic symptom of radial nerve injury, wrist drop. That sounds pretty debilitating.
It can be. Wrist drop occurs because the radial nerve supplies the muscles that extend the wrist and fingers. When the nerve's injured, those muscles weaken, causing the wrist to hang limply. And the severity of those symptoms really depends on the location of the injury.
So an injury higher up closer to the armpit could have a greater impact on function than an injury closer to the wrist.
Exactly. A higher injury might also affect elbow extension, since the triceps muscle, which straightens the arm, is also supplied by the radial nerve.
Hmm.
So understanding the specific muscles affected is crucial for diagnosis and treatment.
Okay, that makes sense. Now, what about the ulnar nerve? I remember you mentioned that it runs along the inside of the elbow where it can be vulnerable to injury.
You're right. The ulnar nerve passes behind the medial epicondyle of the humerus at the elbow. It can be injured from fractures, but it's also commonly compressed in a narrow passageway called the cubital tunnel.
That sounds familiar. Isn't that similar to carpal tunnel syndrome, but at the elbow?
It is similar. Both involve compression of a nerve, leading to symptoms like numbness, tingling, and weakness. In the case of cubital tunnel syndrome, the weakness typically affects the muscles in the hand, especially those involved in fine motor skills and gripping.
And I remember reading about a distinctive deformity that can result from ulnar nerve damage. Ulnar claw hand. Sounds pretty dramatic.
It's a pretty noticeable sign of ulnar nerve dysfunction. The fourth and fifth fingers curl inward, resembling a claw, because the muscles that control them, the lumbricals and interossi, are weakened.
It's incredible how a single nerve can affect such specific muscles and create such a distinct deformity. Speaking of specific muscles, what about the median nerve and its connection to carpal tunnel syndrome? It seems like everyone knows someone who's experienced that.
Carpal tunnel syndrome is very common. The median nerve passes through the carpal tunnel at the wrist, a narrow space formed by bones and ligaments. Repetitive hand motions or other factors can lead to compression of that nerve.
And the classic symptoms are numbness, tingling, and pain in the thumb, index, middle, and part of the ring finger.
Right. I've heard it's often worse at night.
That's right. And along with those sensory symptoms, there can be weakness in thumb movements, especially opposition, that pinching motion we use to pick up small objects. In severe cases, long-term compression can even cause muscle wasting at the base of the thumb.
It's amazing how such a small area can cause so much trouble. But this deep dive into the nerves of the upper limb has really highlighted how much we rely on these intricate pathways for everyday function. Before we move on, though, I remember a point in the sources about the deltoid muscle being a common site for intramuscular injections. Oh, it is. The deltoid is a large, easily accessible muscle, which makes it a prime target for injections. However, it's crucial to inject into the lower half of the muscle to avoid injuring the axillary nerve, which runs along its upper border.
Yeah, it makes sense to avoid that nerve. But now that we've covered nerves and muscles, I'm curious about those clinical tests you mentioned earlier, the ones that are used to assess for specific injuries.
These tests are incredibly valuable tools for healthcare providers. They're designed to isolate specific structures and movements, helping pinpoint the source of a patient's pain or dysfunction.
They sound like detective work for the upper limb. Could you give us an example of one of these tests?
Sure. Let's talk about the Yergason test, which is used to assess the stability of the biceps tendon in the bicipital groove. Imagine you're the patient. The clinician would have you flex your elbow while they resist that movement and simultaneously externally rotate your arm and pull downward on your elbow. If the biceps tendon is unstable, it will kind of pop out of the groove, causing pain.
It sounds like a very specific and targeted test. What are some other tests that clinicians use to evaluate the upper limb?
Well, there's the drop arm test. That's used to detect tears in the rotator cuff, particularly the supraspinatus muscle. The patient raises their arm to shoulder height and then slowly lowers it. If there's a significant tear, the arm will suddenly drop from that abducted position.
Okay, that one sounds pretty straightforward. Are there any tests that are used to evaluate the shoulder joint specifically?
Yeah. The apprehension test is commonly used to assess for chronic shoulder dislocation or labral tears. The clinician positions the patient's arm in a way that might cause the shoulder to dislocate. If the patient has a history of instability or a labral tear, they'll typically show a look of apprehension or alarm, anticipating the shoulder popping out of place.
It's amazing how a simple observation like that can provide so much information. Are there any tests that are used to evaluate the elbow joint?
The elbow stability test is used to assess the integrity of the collateral ligaments, which provides side-to-side stability to the elbow. The clinician applies a valgus stress, pushing the forearm outward, and then a varus stress, pushing the forearm inward, while the elbow is slightly bent. Any gapping or looseness during these movements suggests a potential ligament tear.
So it seems like there's a specific test for almost every structure in the upper limb. These clinical tests really highlight the importance of careful evaluation and diagnosis.
They do, and they underscore how each component of the upper limb bones, joints, muscles, nerves, and ligaments contributes to its overall function. When one part is injured or dysfunctional, it can affect the entire system.
It's like a complex machine where every part needs to be in working order for the whole thing to run smoothly. But we've covered a lot of ground in this deep dive into the anatomy of the upper limb, exploring everything from the skeletal framework to the intricate network of nerves. What's next on our journey?
Well, now that we have a solid foundation, I think it's time to explore how all these elements come together to perform those incredible feats of strength, dexterity, and coordination that make the upper limb so essential to our daily lives.
Okay, I'm ready for the grand finale. Let's synthesize all this information and see how it translates into real-world function. Welcome back to the final part of our deep dive into the upper limb. We've gone from the bones to the joints, the muscles to the nerves. We even talked about some of those fascinating clinical tests.
And now I think it's time to bring it all together, to see how this incredible structure with all of its intricate parts allows us to interact with the world in so many ways.
I'm ready for the grand finale. From what we've learned, it's pretty clear that the upper limb is a masterpiece of strength and finesse.
Absolutely. It can throw a baseball with incredible force, but it can also thread a needle with, delicate precision. It's the seamless integration of all those elements we discussed that really makes this possible.
It's really fascinating how the shape of each bone, the arrangement of the joints, the power of those muscles, and the precision of the nerves all work together in perfect harmony.
It truly is a symphony of movement. And to appreciate this, let's just imagine a very simple action. Reaching for a cup of coffee.
Okay, I'm picturing it. What's happening in my arm as I reach for that cup?
Well, first your brain sends signals down the spinal cord and out through the nerves of the brachial plexus, activating the muscles that are needed to move your arm.
So the nerves are like the conductors, directing this orchestra of muscles.
Exactly. The deltoid muscle contracts, abducting your arm away from your body, while the biceps brachii flexes your elbow, bringing your hand closer to that cup.
And I imagine the rotator cuff muscles are working hard to stabilize that shoulder joint, preventing it from dislocating as I reach forward.
Precisely. Those muscles are essential for keeping the head of the humerus secure in the glenoid cavity, ensuring smooth and controlled movement.
And then as I grasp the cup, the muscles in my forearm and hand kind of take over.
Yes. The flexor muscles in your forearm contract, bending your fingers around the cup's handle, while the muscles of your thenar eminence, which are controlled by the median nerve, allow your thumb to oppose your fingers, providing that secure grip.
It's amazing how many muscles and nerves are involved in even this, seemingly simple action.
And don't forget about the sensory feedback. As you grasp that cup, receptors in your skin and joints are sending information back to your brain, telling you about the cup's shape, its texture, its temperature.
It's like this constant feedback loop, allowing for those real-time adjustments in grip and pressure.
Exactly. It's this incredible interplay between those motor commands from the brain and the sensory feedback from the limb that makes our movements so fluid and adaptable.
It really highlights how the upper limb is so much more than just a collection of parts, right? It's an integrated system that relies on this constant communication and coordination between its components.
And that's why injuries or dysfunctions in one area can have ripple effects throughout that entire system. A nerve injury, for instance, can weaken muscles, impair sensation, and ultimately it can really affect a person's ability to perform even basic tasks.
It's like a chain reaction where a problem in one link can disrupt the function of the entire chain. It's a good reminder to appreciate the complexity of the upper limb and to take care of this incredible part of our bodies.
Absolutely. Whether you're a professional athlete, a musician, or just someone who uses their hands for everyday activities, understanding how this intricate structure works and what can go wrong is essential for maintaining its health and function.
So as we wrap up this deep dive into the upper limb, what key takeaways would you leave our listener with?
Well, first, I'd say marvel at the ingenuity of this structure. It's a true testament to the power of evolution and the remarkable capabilities of the human body.
Second, remember that form follows function. The shape and arrangement of each component are intricately tied to its role in that overall system.
And third, prioritize care and maintenance. Listen to your body, address any pain or discomfort promptly, and take steps to prevent injuries, whether you're on the playing field or just going about your daily routine.
It's like any complex machine. Regular maintenance and prompt attention to any issues can make a world difference in its longevity and performance.
On that note, let's raise our hopefully healthy upper limbs in a toast to to this remarkable feat of biological engineering.
Cheers to the upper limb. And thanks for joining us on this deep dive. We hope you've gained a newfound appreciation for this incredible part of your body and that intricate symphony of movement that it orchestrates.